Hi, I'm Jim Mangraviti from SEAK. I'm here with our president and founder, Steve Babitsky, and we're going to talk to you today about how physicians can earn extra money supplementing their income through 6 different activities. Steve, let's talk about these 6 different activities that physicians can earn extra money on. The first one is consulting. Can you tell us a little bit about how physicians can make extra money through consulting?
Sure. Physicians are hired by clients to do consulting in various topics within their area of expertise. And this is an interesting and fascinating work. You get to work with very smart people. You get to set your own fees, and you really get to solve problems. And there's a lot of really important things about consulting that physicians need to know. First of all, you don't need a license. Many physicians have let their license lapse for various reasons because they're retired or not clinically active anymore. So that's a really good thing for them to be involved in. You don't need an office. Most physician consultants work out of their home office. And you don't need board certification. It doesn't matter to the client whether you're board certified or not. The only thing they're really concerned about is whether or not you can solve their problem. The second really important thing for physicians to know about consulting is that you're paid to solve problems. This is not some government-controlled entity that will tell you that if you do some kind of an operation, you get $129 even though you're saving somebody's life. This private industry is not like that. These companies have significant problems, and if they can hire a physician to come in and check on due diligence or check on coding or whatever other area, they're more than willing to pay a substantial amount of money to get that information. This can also be an entree into changing careers. So many of the people that come to our courses, for example, are considering leaving active clinical practice. But many of them have a 1 or 2 year plan. They're going to think about it, maybe try it out, and then go into a non-clinical practice. Consulting is the perfect way to do that. You get to pick a topic, you start working on it, you start working in the industry, you see if you enjoy it, you see if you're good at it, you see if you can get clients, and you see if you can get paid. And many physicians use consulting as an entree into full-time non-clinical employment. Again, you don't have to do it full-time. You don't have to make that big jump from a clinical practice to a consulting practice. You can do it part-time. You could do it on nights and weekends. So you don't have to give up your clinical practice to start a consulting practice. Now, what do you need to be a good and successful physician consultant? You need to be a self-starter. The big secret about consulting is, generally speaking, you have to get your own work. So you have to be able to get the word out about what you do and how you do it, do a little marketing, and pick up clients. And the physicians that do well at consulting get a lot of repeat business, and then the clients start coming to you. And the last important thing for physicians to know about consulting is maybe the most important. Nowadays, physicians are being squeezed by various reasons economically. Being squeezed by managed care, the Affordable Health Care Act, insurance companies, and all kinds of other entities are trying to squeeze physicians and make the practice of medicine a commodity. Well, consulting is not a commodity. It's a personal business, and therefore physicians, consultants, can earn a substantial amount of money. If they work by the hour, it's not unusual for them to charge $500 an hour, $600 an hour, or more. Sometimes they work by the day, sometimes they work by the job, sometimes they work on a percentage of money they can save the client. So in sum, it can be extremely lucrative for physicians to think about getting into physician consulting.
All right, let's talk about the second area, file review consulting. Can you give a brief overview of the opportunities available for physicians to supplement their income through file review consulting?
Sure. Under the Affordable Health Care Act, there are more and more file reviews, utilization reviews, reviews by insurance companies and by IROs. There are hundreds of thousands of these file reviews which need to be completed on a timely basis. So these companies are looking for physicians who know something about doing file reviews to hire them to get them to do these cases. Again, just like consulting, you can do this off hours. You can do it out of your home office. There's little liability. There's no physician-patient relationship. There's no contact with the patient or the examinee, so there's no liability. You can earn anywhere from $100 an hour to sometimes $200 or $300 an hour. And again, this is net. because you don't have any overhead. It's not like a practice of medicine where there might be a 50% overhead. So if you're earning $200 or $300 an hour doing file reviews, you're probably earning more than you do in your clinical practice. And the last thing is, this is not confrontational. Many physicians don't like to be involved in situations where they have to go testify in depositions or trials or hearings. They're not really up for that. And if you're not up for that kind of confrontation, medical file reviews is a great thing to do because there is no testimony.
All right, how about a third area, writing? Can you talk about that a little bit?
Sure. Many physicians are interested in writing for fun and for profit. We at SEAK had been running writing courses for many years. We've run 20 or 30 writing courses. So what are the advantages of writing? First of all, obviously it can be done from your home office. You don't need board certification or a license. Just like in the other areas, the only thing that people are interested in are in results. Can you turn out a high quality product? You can do technical freelance writing, you could do self-publishing, you could do traditional publishing. And just like consulting, writing could be an entree into other areas. So if you write about an area, you become an expert in the area. Once you become an expert in the area, you can be a consultant. And once you are a consultant, that can lead to full-time employment if you decide to give up clinical medicine. It can be fun, and doctors are allowed to have fun. And this is one of the areas they do have a lot of fun with. It can be rewarding, both personally and professionally. And lastly, it can be quite lucrative. There are physicians who are earning hundreds of thousands of dollars a year doing both technical writing, nonfiction writing, and fiction writing.
How about expert witnessing? Can you talk about that a bit?
Expert witnessing, there are probably 30 or 40,000 medical experts in the United States who are doing medical expert witness work. It's extremely high paying. The clients that we have worked with, whether various specialties, whether it be neurosurgeons, neurologists, orthopedic doctors, forensic psychiatrists, they earn $500 or $600 an hour. We've had examples of them earning up to $1,000 an hour. So for those physicians, we've had an experience with a doctor from Boston who came to one of our courses, opened up a forensic expert witness practice, started to do expert witnessing 1 day a week, and within a year, he was earning more from doing that 1 day a week expert witness practice than he was actually earning in his clinical practice. Now, there are a few downsides. It's not for the thin-skinned. You have to write reports. You have to deal with attorneys, personal injury attorneys, and other attorneys who can be quite aggressive. Even both the retaining attorneys can be aggressive, and the opposing counsel can be aggressive in cross-examination. And you will often have to testify. Now, most of the testimony nowadays is given at depositions. 97% of civil cases settle before trial. So that means the bulk of the testimony is at depositions. But depositions can be difficult and trying, and the doctors that do get into this should make sure they're prepared to testify before they testify at a deposition or at a trial.
How about inventing? Am I talking about inventing?
Inventing is a great area for physicians to consider. Every day, physicians run into problems that they can't deal with. They run into problems at work. They have a test. People come in for a strep test. They have to wait 3 days to find out if the kid has strep. Okay? Well, parents don't want to wait 3 days to find out if somebody has strep, because that's crucially important. Or some other inventions, or putting stuff on apps on the iPhone. So there's a lot of opportunities in inventing. The physicians that do well in inventing are the type of physicians who look at it, instead of looking at a problem and just complaining about it, they look at each problem as an opportunity, and they think to themselves, how can I solve that problem with some kind of an invention? And that's a good way of looking at it. You also have a tremendous opportunity to help people. You help many people. So a physician treating in clinical practice, even nowadays when they're forced to see more and more patients a day, may see 10 or 20 patients a day or more, but that's all you can help. If you come up with an invention, a medical invention, you may help thousands of people, tens of thousands of people, or hundreds of thousands of people, and you may save thousands and thousands of lives. And the last thing I would say about inventing, it can be very, very lucrative. Physicians that invent products or services can make hundreds of thousands of dollars, or in extreme cases, millions of dollars on a medical invention that really takes off. And if you're doing something like that where you're helping thousands or hundreds of thousands of people and you're making a lot of money, it's a lot of fun.
Lastly, Stephen, would you mind addressing IMEs, independent medical examinations?
Sure. Independent medical examinations are those exams done by physicians, usually requested by insurance companies, defense attorneys, case managers, and so forth. And they're exams of injured persons, either in workers' compensation, personal injury, or other kinds of cases. These kind of work, these independent medical exams, can be quite lucrative. And the reason is you're getting paid $1,000 or $1,500 or sometimes more in complicated cases per exam. The clients tend to bunch up the exams, so you don't run around doing one exam here, one exam there. They usually put together 5 or 10 exams in the day for the person. So if a person's charging $1,000 an exam and they do 5 or 10 exams that day, they can make $5,000 to $10,000 for that day's worth of work. And over the course of a year, they can make hundreds of thousands of dollars. There is very, very little overhead for physicians. You don't need an office. Very often you can rent an office, or sometimes the IME companies will provide you with an office. So there's very little overhead. The only overhead is possibly transcription costs or something like that. It's low risk. There are very, very few instances where physicians doing independent medical examinations have been sued successfully. The only times that they potentially can get sued are, number one, if they injure the patient. So if they're, for example, if they're doing an orthopedic exam, they ask the patient to bend over and the patient doesn't really make an attempt to bend over, and they put hands on and push the patient forward, the patient can then allege some kind of an injury. And the second area is potentially if they're involved and engaged in some kind of fraud. Most of the doctors that do this get an inexpensive errors and omissions policy. For a few $1,000s a year. You can cover your very, very low risk. Another advantage of doing IMEs is you can often do this after you retire from clinical practice. Many physicians, when they hit 50 or 60 or higher, want to cut back on their clinical practice. And what a lot of them do that we see that come to our courses is they start doing more and more medical legal work, and particularly do more and more IME exams. So a doctor that was working 5 days a week, or maybe an orthopedic surgeon that stopped surgery, now sets aside 1 day a week, and he does independent medical exams. And that physician could make hundreds of thousands of dollars a year if he does them well. And the specialists that are used most often are mostly musculoskeletal physicians, orthopedic doctors, neurosurgeons, neurologists, PM&R doctors, occupational medicine doctors, pain doctors, physiatrists, and forensic psychiatrists. But there's an opportunity for a lot of different specialties because there's all kinds of different injuries. You can have an ocular injury in a motor vehicle accident or a workers' compensation case, and they need an ophthalmologist. You can have an injury to your ear or vertigo resulting from an accident, and they need an ENT doctor. You can have a dermatitis situation and need a dermatologist. So there are a tremendous amount of opportunities for physicians to earn additional money doing independent medical exams.
And how does SEAK, are there any resources that you could point to that SEAK has that can give physicians further information about how to supplement their income?
Yes, SEAK provides several things for doctors for supplemental income. The first thing I would recommend to people is they go on our website, www.supplementalincome4physicians.com. We have a whole series of free articles and white papers for physicians. You can download them, you can get them for free. We also have a series of courses that we offer on all of these topics, actually, that we've been discussing here today. From consulting, medical file reviews, writing, expert witnessing, inventing, IME exams. We have a whole series of courses. We usually run those courses once or twice a year. And the last thing I'd mention is very often physicians can't get away to come to the courses. They have time schedules, they can't get coverage, they have other commitments. If you can't get coverage and you can't for some reason come to these courses, which are excellent courses by the way, I recommend you give us a call and we can talk to you and we can work with you one-on-one to help you get your supplemental income practice started.
Thank you very much.